Okay, so here you go. A planetary health perspective on the climate crisis and also a little bit on COVID-19. So here we see planet Earth visiting the doctor. He says, oh dear, this doesn't look good. You have sustained severe forest burns and are running a fever from an excess of greenhouse gases. This seems a case of advanced stage Homo sapiens infestation. And then the joke actually continues, but don't worry, that will pass. And in this talk, I'm using different metaphors and analogies, and all of those obviously have their limitations, but maybe they can help to see things from a new perspective. The talk has 4 parts. First, I will say some words about what planetary health is, and then we will take the perspective of a planetary physician to look at the state of planet Earth and its human population. So we take a medical history and examine the patient, we make a diagnosis and discuss the prognosis, and we talk about therapy options. So broadly speaking, planetary health is about the health of humans and the natural systems of the planet on which human health depends. And planetary health builds on other similar concepts, including eco-health, One Health, and conservation medicine, and it wants to integrate those. Also, planetary health builds on public health, international and global health, and goes beyond these by not only considering social, economic, and political conditions and cross-border determinants that need global cooperation, but also explicitly considering the natural systems of the planet. So it's a very broad concept of medicine and health, which the preceding concepts are still valid and important, and they're, so to say, contained in the new concept. So similar to these Russian nesting dolls. So in the end, action is usually at the local level or national level, even when the thinking and the planning was done on a global or planetary scale. In 2014, a very clear and visionary manifesto was published in the medical journal The Lancet, titled From Public to Planetary Health. It stated that human health is massively threatened by the destruction of the Earth's natural systems, and indeed of trust in society. It's a call to action for a new social movement. Well, worth reading. It's just 1 page, actually. 1 year later, a comprehensive scientific report on planetary health was published by a joint commission of the Rockefeller Foundation and The Lancet. Then the Planetary Health Alliance was founded, based at Harvard University, and the scientific journal The Lancet Planetary Health was launched. So planetary health deals with the relationships between human health, the political, economic, and social systems, and the natural systems of our planet, on which the existence of human civilization depends. And the methodology is transdisciplinary. What does that mean? So different disciplines, including health sciences, social sciences, natural sciences, also humanities, as well as local communities, join their perspectives, because only then can we understand the big problem or the big picture. The Lancet Rockefeller Commission has identified 3 key challenges of planetary health. The first is to rethink the relationship between humans and the planet, the imagination challenge. The second is to quantify the health impacts of global environmental change, the knowledge challenge. And the third is to develop and evaluate solution strategies for a more sustainable lifestyle, the implementation challenge. Actually, the Gaia theory from the 1970s is also quite related to planetary health. It says that the Earth as a whole is like a living organism, a superorganism with self-regulatory features and so-called emerging properties. Similar to a beehive, which can keep temperature constant within a certain range, even though the individual bees as insects cannot regulate their body temperature, but then they flap their wings and so on, and they can get temperature homeostasis. So this means that we humans are one part of a bigger entity, our living planet Earth. And from that planetary health perspective, we now look at patient Earth making a visit to the emergency room. So first, we take a medical history. What are the key symptoms? One is climate change. The Earth has a fever, so to say. It's getting warmer and the weather is more variable and less predictable, with more extreme events. For example, more heat and drought in some places, leading to wildfires. And with rising temperatures, polar ice, glaciers, and permafrost are melting and sea levels are rising. Another symptom is pollution of air, water, and soil with waste products and toxic chemicals. The air is polluted from burning fossil fuels and forest fires. A huge number of new chemicals has been released into ecosystems, including pesticides and fertilizer from agriculture, and ever more plastic waste. And we see a massive loss of biodiversity. Natural ecosystems are degraded and they're lost to agriculture and urbanization. Populations of wild animals are shrinking tremendously and species go extinct at an alarming rate. Now moving to the medical exam through those symptoms So here's the fever curve with colored stripes. Blue is colder and red is warmer than average. And you can see a clear increase in temperature in the last 30 years, and particularly the last 10 years. Nearly every year is a new record. And globally, temperatures are about 1 degree higher than before industrialization. So this graph shows the most important greenhouse gas, carbon dioxide or CO2, over the last 300 years. So before industrialization, the concentration was about 280 ppm, and now it's above 410. And now this is over the last 10,000 years. That's the Holocene, which started after the last ice age. So in that time, agriculture developed and human civilizations. It was a very stable climate with CO2 concentrations around 260 to 280. And here's the recent spike. And now this is the last 800,000 years over ice ages and interglacials. And oops, I got an echo again. Someone switch off their sound, please. So here we can see that CO2 concentrations were between 190 and 290 at the maximum. And modern human, Homo sapiens, appeared maybe 300,000 years ago. So what we see is a massive increase in a very short time. And we now have CO2 levels that humans have never experienced before. Now let's look at pollution of air, water, and soils. In some cities, there's so much smog from industry and forest fires that you cannot see the sun. The oceans and many beaches and rivers are full of plastic waste, visible and invisible as microplastics. Humans have produced and released thousands of new chemicals, mostly without fully understanding their impacts. From the film Midway, even on this remote Pacific island, the albatross chicks die because their stomachs are full of plastic waste. The skin of patient Earth. Here are some pictures from the surface. We see monocultures of crops such as palm oil, corn, and soy that replace natural landscapes. Forests, grasslands, and wetlands are lost at an alarming rate. And of course, the species that used to live in them. Species extinction affects big mammals such as rhinos and apes, but also amphibians and insects, as well as plants. Also biodiversity underwater. The warming leads to bleaching and dying of corals, and the species-rich coral reefs disappear, the kind of rainforests of the oceans. And the rate of species extinction is at least 10 to 100 times higher than over the last 10 million years. These are two of the most important sort of diagnosis reports on climate from the IPCC and on biodiversity from the IPBES. And the policy brief versions are actually quite easy to read. I put the links here. So the human ecological footprint increased because firstly, human population increased, and secondly, consumption per capita increased, and that multiplies. So from 1900 to 1950, there was an increase, and then another huge increase until 2010. So this is called the Great Acceleration. Human influence on the planet is now so large, so global, that geologists have suggested that we are in a new geological era following the Holocene, the Anthropocene, so the age of humans. And some have suggested that maybe we should rather call it the Capitalocene, as it's not humans in itself, but our economic system. So how are the humans themselves doing? So in fact, we saw huge health improvement for billions of people over the last decades. Child mortality dropped dramatically and life expectancy increased. Fertility halved over the last 50 years to 2.5 children per woman globally, which means population growth is slowing down. Achievements of global health. However, 1 billion people still live in extreme poverty. Over 800 million people do not have enough food. Over 5 million children die every year from diseases that are preventable or curable, such as birth complications, undernutrition, and infections. At the same time, obesity increased tremendously, now with 2 billion people overweight or obese. More than 400 million have diabetes. Pollution kills 9 million every year. Chronic diseases are on the rise worldwide. And also pandemics are a major threat to human health, including influenza, HIV/AIDS, and now COVID. COVID-19 is also a symptom of the planetary illness that we're describing. Here's a few headlines from The Guardian on the link between the destruction of natural ecosystems and pandemic emergence. Just a couple of weeks ago, actually, a new report on biodiversity and pandemics was published, written by 22 experts. It highlighted that the same human activities that drive climate change and biodiversity loss also drive pandemic risk. Land use change for agriculture and livestock production, disrupting natural ecosystems, plus hunting and trading wild animals. And all that increases the contact between wildlife, domestic animals, and people and their microbes, and thus the risk of new diseases. And they call for prevention of pandemics before they emerge based on a One Health approach, which is kind of similar to Planetary Health. So now moving to the next chapter. After taking the medical history and examining the patient, we put all the information together to make a diagnosis. So first, we check in how far the findings deviate from the healthy state. The concept of the planetary boundaries can be useful here. As with this waterfall, it is advisable not to go too close to the edge, but to keep a safe distance. And researchers have defined indicators and thresholds for different subsystems of the planet, similar to the diagnostic parameters in medicine, which show in how far body functions are within the normal range. And of these planetary boundaries, we already transgressed some, such as biodiversity, and we're close for others. What's quite important to realize is that in the body and in nature, most things are not linear. So first, the system buffers for quite a while until reaching a limit when it suddenly changes or collapses. And sometimes, like in a domino, the next system also collapses. So for biodiversity and for the climate system, several tipping elements and positive feedback loops exist. Just one example, the Greenland ice sheet melts as it gets warmer, and then the thinner it gets, the warmer the air around it, and then it melts even more. And from some point, it will melt down completely, which leads to 7-meter sea level rise in the long run, which already brings us to the prognosis. What are the likely consequences? So at 1.5 degree global warming, impacts are severe, but with some effort and good luck, we may be able to still handle them. At 2 degree, chances are already worse, which is why the global community has agreed in Paris to stay well below 2 degrees of global warming, striving for 1.5 degrees. Because 3 degrees, 4 degrees or more would just be a nightmare. Now, if all the action commitments of all the countries in the world who've signed the Paris Agreement would be fulfilled, then where would we end up? people have calculated this, and it's still 3 degrees. So while the Paris Agreement is there as a framework, the commitments given are still totally insufficient to meet its goals. There are uncertainties in some areas, but in others we also know with quite high confidence. Here's the IPCC statement on the corals. So at 2 degrees of global warming, they're virtually all dead, more than 99%. And this is accompanied by a picture of an underwater graveyard, because the dying is already in full swing with the 1 degree warming that we already have. So what does that mean? The Earth has seen mass extinctions before, the last one with the dinosaurs. The planet will survive. It's about the animals that live now, the corals and bees and chimps, and also the plants and fungi. And above all, it's about us humans, our survival, our well-being, our civilization, peace, and freedom, with now 7.8 billion people, many in coastal areas, who all want to eat and drink every day. We basically harm ourselves and our children and all generations to come. This brings us to one of the 3 key challenges of planetary health. If we destabilize the Earth system, how does that backfire on our own health? It's important to realize that the consequences of global environmental changes on health are mediated through social dynamics. These are represented by these filters here. So ideally, this is to the better, for example, through successful adaptation measures. But it can also go to the worse. So, for example, conflicts over scarce resources. And if several problems appear in parallel and interact with each other, then this will be particularly challenging. Also distinguish direct and indirect health impacts. So health can be directly harmed by extreme events such as floods, storms, heat, and fire. Heat waves are killing people here in Germany every year, and for already hot regions like South Asia, it's even worse. Indirect health impacts include increased transmission of infectious diseases when, for example, mosquitoes move to new areas with global warming, or emerging infections like Nipah and COVID through more intense contact between humans and wildlife, but also famines because of harvest failures due to droughts or floods. Migration and displacement because of famines or due to sea level rise, as well as mental health impacts. And countries can be destabilized politically. Conflicts can escalate, which then has further negative effects on health, of course. So here's the around 7 billion people globally. 1 billion very poor, 1 billion very rich, the rest somewhere in the middle. So the increase in human well-being and health along this development path has been at the expense of hugely increasing our ecological footprint on the planet. And our use of natural resources is now exhausting the planet's buffer capacity. And with some delay, this is now backfiring on via these global environmental changes, climate change, biodiversity loss, etc., and threatening our livelihoods and our health. And the largest burden is among the most vulnerable groups, as they have little margin to buffer any shocks, which is highly unfair as they hardly contributed to the problem. But eventually, of course, we will all suffer. It looks like an emergency. Well, how is emergency actually defined? We can use this emergency formula to think through it for the climate and for COVID-19 for a comparison. So the risk R is calculated from the probability of damage to happen multiplied by the damage, the magnitude of the damage. And then the second factor is the urgency, which is the relationship between reaction time and intervention time. So how long do we need to implement some measures to avert the damage, and how much time is left? Or more figuratively, how far are we away from the iceberg, and how long do we need to steer clear of it? Now let's look at those 2 factors. First, we assess the risk as kind of a scientific diagnosis of the problem. For the coronavirus, infectiousness is a measure of the probability of damage. And one measure of the potential magnitude of the damage is the mortality. And it was quickly clear that this virus could spread quite fast and overwhelm health systems, and that mortality was substantially higher than for influenza, so that the risk was quite high. For climate change, scientists make climate impact assessments. So they calculate the expected temperature rise for certain greenhouse gas emissions, and then the probability for extreme events and the negative impacts on humans, taking adaptive capacity into account. And also the diagnosis there is very clear. The risk of continued climate change is extremely high. Then science can also help forecasting as a kind of prognosis and gain intervention time. So intervention time is a time span from identifying a risk to the point of impact. And often there's a delay between cause and effect. So when you see the first signs, such as the first corona cases or an increase in extreme events, a lot more problems are already on their way, and you have to act to avoid these. And the earlier we realize what's going on, the more intervention time we have. So reaction time is a time span needed to change course and avoid that negative impact. And that depends on hard factors, how quickly we can react, which is like infrastructure, technology, but it also depends on soft factors, such as information networks and trust in political leadership. And this is true for corona as well as climate change. Of course, the timescales are vastly different. To tackle corona, we can react within weeks, while the decarbonization of the world economy will take many years. So it's quite a long braking distance. And urgent action is required when the necessary reaction time is nearly as long as the remaining intervention time. And the risk of damage is high. And if the reaction time is actually longer than the intervention time, then the damage cannot be fully avoided anymore. But often it can still be reduced. So the situation of planet Earth is life-threatening if we don't react, and time is running out, and therefore it's a planetary emergency. Now, how does a good doctor communicate a serious diagnosis? Well, by telling the full truth, explaining, listening, accepting the emotions that come, the denial, the desperation, and that the priorities in life completely change, and help the patients to accept that and jointly discuss the way forward. Because there is no shared diagnosis and sense of urgency, it's very hard to discuss the treatment. And in the climate change debate, the situation often resembles the one in this cartoon. So moving to therapy. As in medicine, there are immediate measures, medium and long-term measures to be taken. In an emergency, one first needs to stabilize the condition of the patient and prevent further blood loss. And similarly, we need to stop harming the planet further, stop harmful subsidies, more coal plants, deforestation, loss of swamps and soils, and stop further pollution. In the long run, we have a double challenge: stopping environmental destruction and at the same time improving health for the poorest. So we have to get into this corner here, achieving good health for all at low ecological cost, as envisioned in the SDGs. And the therapeutic principle is to avoid the unmanageable and manage the unavoidable. Again, a comparison between COVID and climate change. So the unmanageable with COVID-19 is the health system collapse. If we had many times more patients than intensive care beds, the health workers get overwhelmed, and then patients would die also from other diseases. And for the climate, it's a hothouse Earth with runaway warming due to tipping cascades, leading to very hostile conditions for human civilization. So, and as we started acting rather late and some damage is unavoidable, we'll have to deal with that. So for corona, these are serious cases of disease that are resulting from infections that already happened some weeks ago and which the hospitals now need to handle. And for climate change, it is the greenhouse gases that we've already emitted that lead to global warming and all its impacts to which we need to adapt. And of course, adaptation is only possible successfully if we also do mitigation. That means pull the brakes and avoid the big catastrophe that would totally overwhelm us. I will focus on climate in the next slides, but we need to, of course, consider all the planetary systems when we treat the patients, not just treat the fever and forget about the liver or the kidney. So for therapy planning, it's good to know what is our remaining carbon budget. What does that mean? So it's how much CO2 and other greenhouse gases can we still emit into the atmosphere before we cross dangerous planetary boundaries. According to the IPCC report, if we emit another 420 gigatons counting from 2018, we would stay below 1.5 degrees in 2/3 of the models. And there's, of course, some uncertainty around that. And of course, if you do budgets for 2 degrees, then they're larger. But let's now stick with that one. So annual global emissions are around 42 gigatons. So that meant in 2018, we had like 10 years left at current emissions. And now in late 2020, we have 300 gigatons left. Can someone switch off their mic because I can hear myself? Thank you. So what does that mean? We have to become clean in a way as soon as possible. So that means stop burning fossil fuels and emitting more CO2 to the atmosphere, which means that we need to quickly decarbonize our economy. And we only have a quota of 420 gigatons plus minus globally, well, by now, 300 plus minus, during this withdrawal phase. And we have to organize this intelligently. If we continue to be wasteful over the next few years, it will then become impossible to achieve the goal. And we also have to distribute wisely. These 400 gigatons was global. So who is allowed how much? At the same time, we need to fight poverty. So which path do we choose to get to net zero emissions within the budget? The later we start reducing, the more abrupt we need to reduce, which implies much higher social and economic costs if we switch off everything suddenly. And if we then don't manage to reduce deeply, then we'll overdraw the budget and the Earth will heat up more with even higher risks for livelihoods and health, which is why it's so important to start immediately. Now, these are 42 coffee beans. They represent the 42 gigatons of CO2 equivalents of global annual emissions. And I'm showing you a distribution over the entire world population, divided into 10 evenly sized groups according to their wealth. The poorer half of the world population emits only about 1/10 of the total, four beans. And the richest 10% of the world population emits half, 21 beans. Quiz question, where should we start to reduce? And now these are calculations per person by countries. In Germany, we emit around 9 tons per person and year, much above the global average. And you can't discuss the climate crisis without talking about justice. Who caused the problem? Who can invest in the transition? Who is struggling to survive, and even more so in a changing climate? Who already has a high living standard and is consuming luxury goods? And where are millions of people striving towards a decent life? And it becomes pretty clear that the rich industrial countries have to reduce faster and help the others. And to accomplish that in the time left until natural systems will crumble, small stepwise improvements are not sufficient. We need a radical reshaping of our whole way of living, our way of doing business, a great transformation of society. An unprecedented challenge. Will we make it? Well, it will require some major shifts in our way of thinking, as problems can never be solved with the same mindset that created them, as Einstein wisely realized. Which brings us to maybe the core of the problem, the relationship between humans and the planet. And also in this previous graph, I showed humans and nature or planet separated. And through our technological advances, we imagine that we are somehow independent. And we've also distanced ourselves emotionally, regarding nature as a pile of resources. In reality, we are, of course, part of nature. We breathe air, we drink water, we eat other living beings. Nature penetrates us. Millions of microbes live in our guts, on our skin. They're vital for our well-being. Exploitation of nature worked fine for a while there were relatively few humans and a lot of nature. And this has, in the Anthropocene, the whole planet is influenced by humans. So there's virtually no untouched nature anymore. So nature is part of us and we are part of nature. The separation is an illusion. We need to realize that we are one component of a highly complex web of life, of our living planet, and that we totally depend on it. Our health, our society, our economy all depend on intact nature, on a stable climate. This also has an ethical dimension. What value do we assign nature? Is our relationship characterized by exploitation or by awe, reverence, and connectedness? Albert Schweitzer's ethics of reverence for life is an attempt to overcome our restricted ethics that only contains humans and that considers the rest of the planet as a pile of resources. It's a comprehensive ethics that values all living beings. The encyclical letter Laudato Si by Pope Francis is called On Care for Our Common Home, which means planet Earth. He talks about awe and wonder towards nature versus the attitude of a master, consumer, and exploiter. And the Dalai Lama emphasizes that it's not enough to train our brains, we need to develop our hearts towards more compassion if we want to survive. Of course, these insights are not really new, and neither is the idea of planetary health. Many indigenous peoples have preserved this wisdom over generations and have a spiritual relationship to nature or Mother Earth, if they and their culture have not been destroyed already. It's also a question of what we believe is human nature, our Menschenbild, as we say in German, image of man, as this shapes our behavior. Are humans greedy, selfish, and only thinking of their personal advantage as this Homo economicus in the model of the economists? Or are humans generous, compassionate with others, and stand up for justice? Well, we're not either or. Both options are inside us. In each person, the two wolves from the Indian fable are fighting. Greed against generosity, arrogance against humility, competition against collaboration. And which wolf will win? The one we feed, both as an individual and as a society. Societal structures play an important role here in what kind of world we grow up and live. Is greed considered normal and boasting nearly a duty, or are other values important? So now let's talk about concrete solution strategies for a sustainable lifestyle. We have to move from knowledge to action. The ecological footprint is well known. Everybody can calculate his or her own footprint with online tools, and it's important to make efforts to reduce it already for one's own credibility. But it is not sufficient. We need to jointly change the structures that are hurting people and nature. We need to influence politics, contribute to the great transformation of society. That is the handprint. One example would be taking the train instead of flying is an example for footprint, and pushing politicians so that trains become the cheaper and easier choice would be handprint. Which means that we have to change the rules by which we play, the structures, and these are decided higher up. The leverage is highest there, which does not mean that we should not also act on the middle and lower levels. We need all of that, and they all interact. We need to realize that it's not about losing something, but about gaining something. Fewer cars, less traffic jams, cleaner air, more exercise, more green space, less stress, more connectedness. Many solutions are synergistic. They're win-win solutions. They're good for the planet and also good for our own health, even in the short term. Field with win-win potential is agriculture. As we currently practice it, it's responsible for 1/4 of global greenhouse gas emissions, for deforestation, land degradation, and species loss. Growing food differently in a more sort of ecological way can preserve biodiversity, mitigate climate change, and improve human nutrition and health. The solutions exist. And as part of this great transformation of all societies towards a sustainable and healthy life, the richer societies need to decrease their footprint, while the poorer people need to improve their living standard and health without following the same destructive path. And my research project Farm in Bangladesh wants to make a contribution in that direction by reducing malnutrition in a sustainable way. And just a couple of slides about Farm, for those who don't know. So Farm stands for Food and Agricultural Approaches to Reducing Malnutrition. So we're evaluating a homestead food production program that's delivered by the NGO Helen Keller International. And the intervention has many components that are acting synergistically, including vegetable gardens and chicken rearing, nutrition and hygiene education. And we conducted a cluster randomized trial over 4 years, including 2,700 women and their children in 96 villages in Habiganj district in Bangladesh. The primary outcome is stunting in children that were conceived after the start of the intervention. It's an indicator for chronic undernutrition. And we added various projects from different disciplines, including on gender aspects in agriculture, on food hygiene and the role of gut infections and chronic gut inflammation and microbiome in children, the link between nutrition and depression, the influence of arsenic and mycotoxins on birth outcomes, and the impacts of a flooding event on food security and nutrition. We also have a sub-project on an organic fertilizer made from cow urine mixed with biochar, which is produced from crop residues like rice straw. And this fertilizer vastly increased the garden yield, the vegetable yields in the gardens. And it also binds in the soil. The ecological restoration of destroyed ecosystems like forests and swamps also has a huge win potential. They can bind a lot of CO2, we save endangered species, and intact ecosystems are more resilient to climate change. And besides that, protecting the nature would also be primary prevention of pandemics. The Guardian writer George Monbiot and Greta Thunberg recorded a very nice enthusiastic short video message about this natural climate solution. And there are more win-win solutions. This drawdown project, they collect all these approaches and their potential. In conclusion, 2 summary statements made by the Lancet commissions. The first says climate change is the biggest global health threat of the 21st century because it destroys living conditions on the planet. Storms and floods, heat and drought, harvest failures and famines, infections, conflicts and migration. It hits poorest people most and first and enhances inequality. It threatens the survival of our civilization. And the second statement is that tackling climate change could be the greatest global health opportunity of the 21st century. Because what we need to do for the climate is basically similar stuff we need to do for health anyway, a win-win situation, making cities easy to walk and bike, to have more exercise, reducing air pollution, eating less meat and more vegetables. All these are good for the planet and good for our health. Few thoughts on the corona pandemic as we're moving towards the end. So we're currently experiencing what it means to be in a crisis that highlights the vulnerability of our health systems, of our societies. It also threatens many past gains in global health. For example, food insecurity is rising again in many countries. And we realize how close everything is connected on this planet, that we're all in this together. And we experience what it means to take a crisis seriously and deal with risks and uncertainties. The role of science in this and how ignoring the facts is being punished. The impossible was suddenly possible. Money was available. People were forced to change their behaviors way more radically than the Green Movement ever asked for. And most people cooperate and act in solidarity with others because they realize it's about their own health and that of their loved ones. Here's a cartoon, it's just in German, but I added the English translation here on the top. Let me read it. I think it's quite funny, but of course, Corona will not really help the planet, even though emissions went down a bit for a while due to the economic recession. You cannot compare it to an obese person who wants to lose weight. And if they have a bout of acute diarrhea over a week, then they will lose weight in the most cruel way, but it won't really last because you need a change in lifestyle for really losing weight. And the same is for if we want to decarbonize the economy, an economic shock is not what we want. But maybe Corona can be a wake-up call and an opportunity to take care of the other crisis. Because going back to the old, unhealthy and destructive situation would be something like medical malpractice. So far, the climate crisis has not been treated adequately. We could use the massive economic stimulus packages to steer towards healthy people on a healthy planet, as many have been calling for, including the Club of Rome. The crisis shines a spotlight on many problems, from the healthcare system to working conditions in the meat industry to wildlife trade. And we could use the opportunity to reconsider what is really important to us and adjust our priorities. New forms of organization can help, as described in this wonderful book by Lalou, with less hierarchies and more purpose. And there are several companies actually already working in this way and very successfully, including the home care provider Bootzorg in the Netherlands. If you think about our healthcare system, our old people's homes, we really need a fundamental change there, both for the people and for the planet. The thing is that the health community also in Germany is now rising to the challenge. The Health for Future movement was founded a year ago, has grown tremendously, with groups now in many cities, including Heidelberg, adding our voice and our perspectives to the For Future movement. Also, the Scientists for Future have a group here in Heidelberg, and colleagues come up with creative ways of raising attention. For example, with patient Earth here in a wheelchair walking through the center of Munich. And during lockdown this summer, the Planetary Health Academy was running started through the lockdown into the summer, for health professionals, students, and anyone else who was interested. It included Eckhard von Hirschhausen, Luisa Neubauer from Fridays for Future, various scientists, also myself. And the second academy is actually starting this month, and now in English, and you can sign up on the website. The motto is From Knowledge to Transformative Action. And with several planetary health enthusiasts from all over the globe, we've recently published a suggestion for a planetary health pledge, kind of an update of the Hippocratic Oath and the Declaration of Geneva in the era of the Anthropocene, where we cannot just focus on humans without considering the natural systems of the planet. Many people are already part of the movement, probably also some of you. And the good news is that we don't need to convince everybody. The large majority only has to tolerate the changes. Certain people at the other end of the spectrum, you may never convince. The goal is to make more people to start to act so that we reach a critical mass that has political influence to get to a social tipping point on climate action. And many good solutions exist already, as I mentioned, but they're still in a niche. And sudden events in mega trends can open up windows of opportunity, which then allow them to become the new mainstream. And such a window of opportunity has been opened with the Fridays for Future movement and possibly now with the Corona crisis. It's clear that the fundamental change that we need will not happen by itself and from above. Societal actors need to push for it. There are massive interests against it. It's not just about facts and knowledge, it's about power. The transformation towards sustainable societies is resisted by those who profit from the status quo. So we saw that also how it worked with the cigarette industry and smoking. And as Gandhi wisely said, first they ignore you, then they laugh at you, then they fight you, and then you win. So we need to form alliances and create a positive vision for a better, healthier, sustainable world, which already exists in niches. There's no blueprint for this transformation. It's an unprecedented challenge. We have to experiment, be creative, act into the open, learning while doing. And starting to act will unleash a lot of energy. Enthusiasm is important, also having fun. And the first step is to realize that we are in an emergency. Our house is on fire and business as usual is no longer appropriate. In summary, humanity is about to destroy its own future on the planet: climate change, biodiversity loss, pollution of air, water, and soil. This is the biggest possible threat for human health, a medical emergency of planetary scale. At the same time, we have an enormous justice issue. Millions of people live in extreme poverty. They hardly contribute to climate change, but heavily suffer from it. We urgently need a fundamental transformation of our societies based on the insight that we are a part of nature and that our well-being depends on it. This does not mean sacrifice, but rather an increase in quality of life, a reconsideration of what is really important. Many thanks.